Hello, everyone. Thank you so much for joining. We will give it another minute for other people to join us. Hello, and welcome to the webinar titled Investing in Girls, Key Changes in Bilateral Donor Funding Landscape 2021 Update. We're so delighted to have you join us. While we wait for other participants to join, kindly introduce yourselves in the chat. We would love to know where you all are joining us from and and how are you feeling today. For myself, I am Pooja. I work with Egypt as the Girl and Youth Engagement Specialist, and I'm from India. And I'm very happy to have this opportunity to moderate the webinar today. And my colleague Flora Moshiri, Egypt's Communications and Membership Officer, will be providing technological support for today's event. Before we begin, there are just a few reminders for all of you. It would be great if all of you could keep yourselves on mute while the presentation is being made. Also, if possible, it would be great if all of you could add your pronouns because that allows us to address each other in chat respectfully. We also have interpretation available for today's webinar in Spanish and French. So please ensure that you've chosen the suitable channel for yourself. And also, the chat feature is there, so feel free to engage with each other. But when you do so, please be respectful. We would also like to remind that at Egypt, we are very mindful about creating safe spaces for everyone. We request everyone joining us today to kindly practice these values that we've listed out on the slide, which includes mindfulness, respect, empathy, care, and others that you can see on the screen. In case you feel unsafe or uncomfortable at any point during the webinar, please do what is necessary to help yourself. If that requires you to step away from this webinar, that is perfectly okay. Kindly do so. Alternatively, you can write to me, but if you prefer to write to somebody who's not available or not present in this space, then you can reach out to Elsie from Plan International, who is our second level safeguarding focal point for today's event. Our email IDs will be made available in the chat for your reference. All right, just before we begin, once again, thank you so much for joining today's webinar, co-hosted by Egypt and Gage. We're so glad to see many familiar names and are also thrilled to see so many new ones as well. For those who are joining us for the first time, here is the brief introduction to who we are and what we do. Adolescent Girls Investment Plan, or Egypt as we call it in short, is a global intergenerational feminist coalition with members from girl-centered, global, and national level research and development organizations. We envision a world where girls have the voice, choice, and agency to determine their own futures, supported by holistic investment that responds to the full complexity of girls' lives and needs. In terms of our mission, what we're trying to do is to close the large gap which is persistent between the resources, evidence, and commitments for adolescent girls and their lived realities. And you can see on this screen that we have many member organizations who are united by their commitment to stand alongside adolescent girls to advance girls' rights and gender equality. Together, we collaborate to drive political commitment and evidence-informed investments to shift outcomes for adolescent girls. What we also do is to collectively advocate for their meaningful engagement, resourcing, and co-leadership. As you see in the logos, Gage is also our member organization, actively leading on the research aspect on the state of adolescent girls in today's world. And today's webinar is about the latest research on the status of funding to adolescent girls. So just quickly in terms of the agenda for today's webinar, we have already covered the welcoming and welcome again. We have done the technology aspects and we've covered the safeguarding and well-being aspect as well. For the next part, we would be heading straight into the presentation, which will be led by our colleague Silvia. After that, we have three amazing speakers, Louisa, Dr. Rachel, and Dr. Faith, who would be responding to the research insights from their own perspectives. And after that, for the last 15 minutes, we will open it for the audience questioning. So while you're listening to the speakers or the research facts, if you have any questions, please jot them down because we do have the slot at the end to take your questions and respond to those. So without further ado, I am delighted to invite Silvia to lead us into the next part. Silvia is a researcher at the Gender and Adolescent Global Evidence or GAGE program at ODI, specializing in gender, adolescence, displacement, and mixed methods and evaluation research. At GAGE, Silvia conducts evidence generation and policy and engagement activities across the program with specific focus on vulnerable young people, including refugees, child brides, and adolescents with disabilities. She's particularly interested in measurement and programming that approaches adolescent well-being across domains, including ensuring access to safe and quality education, skills training, freedom from violence, and psychosocial well-being. Before I give the mic to Silvia, I would like to quickly remind that this part of the presentation will be in English because of the technological constraints and limitations of presenting data in just one slide. But at the same time, we are making a link available to you in the chat, using which you can find the access to the presentation in Spanish and French. So if you click on those links, you can follow along with us in Spanish and French as needed. Just a reminder, please take a minute to do that. And with that, I would like to hand over to you, Silvia. Welcome. Please take the mic.
Thank you. Thank you very much, Pooja. I hope everyone can hear me well. And thank you to all who are joining the webinar today to launch our research, Investing in Girls, Key Changes in the Bilateral Donor Funding Landscape. And this is our 2021 data update. Next slide, please. So over the next 15 to 20 minutes, I will be providing the context to situate this research study, as well as a brief overview of the AGIP and GAGE research and evidence generation work streams. I will take you through the methodology we adopted for this study and highlight some of our key global results. And then I'll conclude with some recommendations going forward. Next slide, please. So to provide a bit of context, we know that investing in adolescent girls can bring significant returns. Adolescence, the ages of 10 to 19, is a key life stage that brings major social, physical, and psychological changes and lays the foundations for well-being in later life. This time period is described as a critical window of opportunity, where interventions and investments indeed can have a major impact countering poverty, gender norms and inequality, and where positive development trajectories and indeed intergenerational trajectories can be nurtured. We note that UNICEF has just published the investment case for girls as linked to its adolescent girl strategy, and we know that the momentum for investing in girls is really increasing. However, we're playing a bit of catch up because historically there has been a lack of priority given to adolescents as a cohort generally and girls in particular. Since the 2014 Girls Summit in London and the 2016 Lancet Commission on Adolescent Health and Wellbeing, there has been a growing focus on adolescents as a priority population, but it is important to see how this momentum overlaps with time and how commitments are maintained. So at the SDG Summit underway marks the midpoint of the Agenda 2030, but we've heard all over the weekend and in events this week that the pledge to leave no one behind is in peril. At the halfway point to the SDGs, there is an urgent need for detailed and up-to-date understanding of the funding that exists to support the well-being and development of adolescent girls. We know that adolescents are not sufficiently captured in SDG data collection and can risk remaining invisible. So through this report, we address the lack of evidence on the state of financial investments into adolescent girls. We hope that that you will sort of find that this research also fills a major gap on drawing on published data on official development assistance, or ODA, that has been devoted to adolescent girls. Next slide, please. So just a word on the AGIP Engage research. As Pooja mentioned, we're the Gender and Adolescence Global Evidence Research Program, and we follow the lives of 20,000 adolescents in the Global South through mixed methods, longitudinal research and evaluation. Within the AGIP Coalition, we work to generate and disseminate evidence to bridge the gap between resources, evidence, and commitments for adolescent girls globally. You can see some of the thanks, Pooja. You can see some of our outputs on the screen below. We've recently launched a new research study looking at resourcing girls directly, so the value and challenges of moving money to girl and youth-led groups. We've also published research on adolescents, youth, and the SDGs, so really taking a deep dive on what the data accrued by the SDGs is telling us across adolescent well-being domains. And we've also captured adolescent girls' voices at various intervals within the COVID-19 pandemic and recovery periods. Next slide, please. So just a word on this report. So we published our first report in this series last year, Investing in Girls, which was the first report to map investments in adolescent girls using the most recent available data at the time, which took us up to 2020. In that research, we found that the amount of funding going to adolescent girls did not match the needs of the large adolescent and youth populations in low and middle income country contexts. We also found that the funding that was flowing to adolescent girls' needs was unequally distributed across sectors and across population groups. Our report published last year, we feel, established an important baseline regarding the adolescent girl funding landscape. However, with partners at AGIP and beyond, we felt that it was vital to continue updating this research in order to provide the most up-to-date data, particularly in the current climate, in context of cuts in official development assistance for all populations, in the global rollback on gender equality, and in the context of the post-pandemic recovery. So this report here provides the most recent data on official development assistance going to girls. Next slide, please. Yeah, one more. So how did we go about doing this? We reviewed data from the largest donor official development assistance, or ODA, tracking data set, and that is of the OECD credit reporting system. From that database, we selected the top 10 gender equality donors at both global levels, and we also did country-specific case studies in Ethiopia and Bangladesh. And we were able to extrapolate investment data across all low and middle income countries on the database for 2021. In this review, and in our previous review as well, we only included ODA that has gender equality as either a significant or principal component of the program. These are, we were able to do this through the gender equality markers, where a score of 1 is given to gender equality as a significant component. So projects that have gender equality as an important objective, but not the main reason for that project. And a score of 2 in the gender equality marker which relates to the gender equality as a principal component, where gender equality is the main objective of the project, as well as fundamental to its design and its results. So we were quite inclusive in including both of those markers. Finally, we selected ODA that included adolescents or youth as a target population. This was tricky as there are no adolescent age markers in the OECD database. So we also included other age ranges that we thought pertinent, such including terms as young people or girls, alongside adolescents and youth, of course. Next slide. So what did we find? Despite heightened needs during the COVID-19 pandemic, we found that the percentage of gender and adolescent targeted official development assistance as a share of overall ODA decreased between 2020 and 2021. So you see on the bar chart that it decreased from 5.6% of ODA in 2020 to 5.5% in 21, which is the lowest level since 2017. We do note that this relates to a slight increase in the dollar amount of gender and adolescent targeted ODA. So it went from $7.6 billion in 2020 to $7.7 billion in 2021. However, again, the percentage that is flowing to adolescent girls dropped. And next slide, please. We also looked at the distribution of this investment by age group. And interestingly, compared to 2020, in 21, there were greater investments in youth-targeted programming. So you can see that in the blue in the pie charts on your screen. So the amount allocated to youth increased, whilst the amount allocated to adolescents as a category in sort of lime green, yellow, decreased from 2020 to 2021. So we can hypothesize that this might be due to investments to account for post-pandemic recovery and resilience, which focused primarily on economic empowerment programs and skills building, placing additional emphasis on the youth category, which perhaps accounts for that increase for youth and diminishing investment for adolescents as a category. Next slide. So we also looked at gender equality focused programming. So this relates to the gender equality markers I highlighted in the methodology slide. We looked at the amount of gender and adolescent targeted ODA that had gender as a principal component and objective of the investment. And whilst we see that gender equality as principal component investment increases from 2016 to 2020, we note a rather sharp decrease from $1.7 billion in 2020 to $1.3 billion in 2021. So I would be interested to hear any reflections on the speculations as to why the gender principal component dropped for adolescent girls. We have a short animation in the next slide to show how to highlight the changes by donors. So again, this research sort of takes into account the top 10 gender equality donors. And so looking at the key changes over time really illustrates the changing priorities. So in yes, thank you, Pooja. The bar charts in green show the top donors and the amounts that they dispersed to adolescent girls in 2020, overlaid by the investments by those same donors in 2021 in orange. So our report obviously goes into a lot more depth and a lot more explanation, but for the sake of this presentation, I'd like to highlight that the United Kingdom was the top donor for gender and adolescent tagged ODA in 2020, falling to 5th place in 2021, whilst Canada went from being the 4th donor in 2020 to the 1st donor to the top of your screens in 2021, with the increased amounts you can see on your screens. So the landscape for donors is changing. Next slide, please. One more. As per the first report, we looked at how these investments overlaid with the SDG domains. You can see on the pie chart that the top 4 sectors that are receiving adolescent and gender ODA are SDG 4, education, SDG 3, good health and well-being, SDG 1, the alleviation of poverty, and SDG 5, gender equality. These top 4 sectors remain unchanged compared to 2020. However, in the next slide, we do note some significant changes worth highlighting. And again, I refer to the report for some more in-depth data and discussions on this theme. However, we note that the percentage going to education decreased from 51% to 45% of the total pot going to adolescent girls. However, it still is approximately half. So approximately half of gender and adolescent ODA is flowing towards SDG 4. There was an increase in the percentage going to health from 14% to 17% in 2021, as well as an increase in poverty alleviation, marginally from 11% to 12% of the pot going to adolescent girls. The percentage, noteworthy, the percentage going to gender equality remains unchanged as 2020. Next slide. We also note that WASH, so SDG 6, clean water and sanitation, as well as SDG 8, decent work and economic growth, are both SDG domains that saw increased investment, potentially accounting for the post-pandemic recovery period. And again, the increased attention to decent work and economic empowerment initiatives. However, sadly, we note that climate action saw a 9% decrease from 2020 to 2021. So less investments into climate action in the post-pandemic period. Next slide. When looking at how adolescent and gender ODA intersects with disabilities, we see that the amount of gender and adolescent targeted ODA that supports and targets young people with disabilities doubled, albeit from a very low baseline. So moving from 0.1 billion in 2020 to 0.2 billion in 2021. So this increased to higher than pre-pandemic levels. The bar chart on the screen, however, looks at trends over time for gender and adolescent and disability targeted ODA. And this, I think, really highlights the criticality of monitoring trends over time. So whilst we see a peak in 2019 on your screens, which has been said to be linked to the Disability Summit and commitments made, investment commitments made at the summit, this falls drastically in 2020. And we now note it has picked up again. So it is really important to monitor trends over time to see that no one is left behind and that commitments are maintained, not just at summits and at conferences, but in the long run. Next slide, please. In contrast, sorry, one slide back. Yeah. In contrast, the amount of investment in child marriage programming decreased from 1.8 billion in 2020 to 1.7 billion in 2021. And again, eager for some reflections I know we'll have from our expert panelists a bit later. Finally, we also looked at the funding landscape for girl and youth-led organizations, again, as this is linked to a subsequent work stream we are working on. We see, the amount unchanged. So in 2021, only approximately 1% of all of the gender and adolescent targeted ODA went to girl and youth-led efforts and organizations and networks, and this remained unchanged from 2020. Notwithstanding key informants highlighting that young people, you can read on the quote there, young people have specific dedicated needs. It's not for us to tell them what those are, but to bring them into the process, into the design, programming, and agendas, and decide what works for them. However, we see that funding to girl and youth-led groups remains unchanged. I will just say one word on the country level findings. Again, our report goes into much more depth on our case studies in Bangladesh and Ethiopia. The amount of gender and adolescent targeted ODA for Ethiopia fell drastically from $299 million in 2020 to 225 in 2021, and this is the lowest amount received in the last 6 years. So it is important, again, to understand these trends, also because of the widespread worsening levels we know in Ethiopia for our own research at Gage, worsening levels of GBV, sexual violence. Thank you. Next slide. So overall, what have we found? Through our analysis underscores that post-pandemic investments are not reaching adolescent girls. Although there was a slight improvement in the absolute amount of gender and adolescent targeted ODA, there were no improvements percentage-wise. And in fact, there was a slight decrease from 5.5% to 5.6% in 2020 to 5.5% in 2021. So this translates to that the amount of gender and adolescent ODA does not at all match the high adolescent and youth population across low and middle income countries. So there remains, notwithstanding the momentum, there remains a significant disconnect between the large adolescent and youth populations in many low and middle income countries, ranging from 25% of the populations in less developed countries to 32% in the least developed countries, but the percentage of ODA that exists to support them across the domains of well-being and for girl and youth-led efforts remains very, very low. So this really reinforces the urgency of increasing advocacy and evidence on funding programming that targets adolescent girls. While noting, it's important to note, and again to track important improvements in disability-focused ODA and skills building, there are also likewise worrying trends that investments in child marriage and gender and adolescent responsive climate justice remain underfunded and have in fact decreased. Finally, and we have made this point before, there is insufficient gender and age disaggregation in the OECD database repository for ODA. So we really recommend the introduction of an age-related marker in OECD reporting to also ensure consistent and disaggregated, more granular reporting by donors. Last slide, please. You can see our report, our first report published last year, at the end of last year, on the left, and that looks at investment data trends from 2016 to 2020. I've just presented our 2021 update or highlighted some of the key findings. We hope to continue our trend analysis because it is critical to really see how investments for girls change over time and relate to the increased momentum and advocacy around adolescent girls to see if investments match. I will pause there. Thank you very much and eager to hear the discussions next.
Thank you so much, Silvia, for sharing the latest insights on the adolescent and gender-targeted ODA funding. It is definitely reassuring to see that gender equality, well-being, and quality education continue to remain the top priorities. And at the same time, the decrease in funding education, climate action, and child marriage programming is concerning for the well-being of adolescent girls and the overall achievement of SDGs, given the timeline we're at. Considering how much data we had packed in there, we have three amazing speakers bringing in diverse insights from the development sector. We have Louisa Fernanda, Dr. Faith, and Dr. Rachel here with us to respond to the research insights. All of them are spearheading girls' rights and gender equality advocacy and programming in different ways, and we're so grateful to have all of you here with us today. To start with, I would like to introduce and invite Louisa to take the mic. Just reminding everyone that we have the simultaneous interpretation in Spanish and French. So please ensure that you're on the correct channel. And just to introduce Louisa, welcome so much, Louisa. Louisa is a young leader from Mexico. She is currently a member of Egypt's Adolescent Girl Advisory Body. She is a surgeon attending internship. She has been volunteering with the Mexican Foundation for Family Planning for 9 years and was selected the vice president in 2021 due to her outstanding advocacy work on sexual and reproductive health and rights. She is also a part of the IPPF Acro Youth Network and has been selected for the IPPF Global Nominations and Governance Committee. And to top that with more amazing work she's doing, she's also a leader of the first Mexican chapter of Women in Global Health. With that, I would like to hand over to you, Luisa.
Hola, muchas gracias y buenos días desde México. Bueno, para comenzar me gustaría platicar sobre los Objetivos de Desarrollo Sostenible. Creo que es algo impactante y como dicen en una película de superhéroes, pues un gran poder conlleva una gran responsabilidad. Entonces, en este caso, pues el gran poder son los Objetivos del Desarrollo Sostenible. Y pues la gran responsabilidad que nos toca pues a nosotros es justamente ver cómo trabajamos en ellos y cómo los aplicamos. He tenido la fortuna de comenzar con mi activismo y voluntariado desde hace 9 años. Entonces un día en la prepa se acercaron y me preguntaron si quería entrar a un curso de sexualidad. Me llamó muchísimo la atención porque pues eran temas que en ese momento eran muy tabúes en nuestra generación. Entonces creo que en este momento lo siguen siendo, pero pues hemos podido generar políticas públicas que nos permitan hablar un poquito más sobre los temas. Entonces, esa fue la forma en la que yo comencé en el activismo, porque conocí a la Fundación Mexicana para la Planeación Familiar, que alias MEXFAM, y pues vi que todo el horizonte era mucho más amplio de lo que yo veía a simple vista. Entonces, eh, pues me gustaba poderle contar a las juventudes sobre los derechos sexuales y reproductivos de una forma divertida, de una forma muy diferente a lo que llegaban a darnos en clase o simplemente pues omitían el tema algunos maestros. Entonces esto era como un horizonte muy diferente. Incluso pues me veían como un punto focal donde las juventudes, las adolescentes podían ir conmigo y podían preguntarme muchas cosas. Posterior a esto, con el paso de los años, pues empecé a desarrollar habilidades para poder hablar en público. Comenzaron a capacitarme en temas de liderazgo y pues me invitaron a ser parte de los jóvenes activistas de la red de IPPF. También comenzaron a interesarme mucho los temas de incidencia, los temas sobre la Agenda 2030 más que nada. Y yo creo que hasta este momento yo tenía incluso un contexto muy diferente de lo que era hablar sobre derechos sexuales y reproductivos. Y ya cuando empecé a trabajar con la Agenda 2030, me abrí completamente los ojos y vi que los objetivos del desarrollo sostenible se relacionan entre sí. Entonces, ¿por qué no puedes tener un libre ejercicio de tus derechos si no los conoces y si no tienes un mundo donde aplicarlos? Entonces, pues también parte de esta historia es que gracias al esfuerzo que hice en conjunto con MEXFAM, pues me invitaron a formar parte de su órgano de gobierno y posteriormente, desde hace 2 años, como lo menciona Puya, pues estoy en la vicepresidencia. Me comenzaron a apasionar los temas de juventudes, de liderazgo, de gobernanza. Y pues me di cuenta que es muy importante que nos tengamos que ir actualizando en los temas de políticas públicas, porque pues de un año a otro en cada país, en cada región, pues se generan muchísimas políticas públicas y es importante que como organizaciones sepamos dónde se están aplicando y cómo. También no podemos solamente quedarnos con nuestra opinión, tenemos que ser receptivos, aprender de los demás. Todos vivimos en contextos muy diferentes y me parece a mí increíble justamente en esta parte de platicar sobre los planes de inversión, que siempre centramos estas pláticas o estos encuentros o estos congresos en números grandes, en presentar los impactos que se han tenido con la población en general, pero me parece mucho más importante focalizar la mirada en lo que debemos con las niñas y adolescentes. Entonces, a esto me refiero en que pues las acciones que nosotras hacemos cambian vidas de manera individual. En mi caso es como cambió la vida de las niñas al atenderlas y escucharlas. Cambiamos vidas, prevenimos violencias, generamos futuros seguros, que es lo más importante. Entonces no hay que verlo solo como un proyecto en general, sino la forma en cómo impactamos la vida de las niñas y adolescentes en un contexto propio. También cuando hablo sobre métodos anticonceptivos, en el caso del activismo, trato de hacerlo en un modo integral. Entonces, cada vez que hablemos de los objetivos de desarrollo sostenible, hay que hacerlo de un modo integral, porque no solamente tenemos que hablar en el caso de sexualidad, de goce de placer. Entonces, tenemos que tener un acceso a fondos. Hago un llamado para que no sean recortados, que la mayoría de las voces de las juventudes seamos escuchadas y que tenemos que tener un acceso accesible y nos tienen que capacitar. Creo que no tengo más tiempo, traté de hablar un poquito lento, pero me parece que deben de empezar a visualizarnos como parte del futuro y el ahora.
Thank you
Muchas
so much,
gracias.
Louisa. Thank you so much for sharing your personal and professional experience of what the possibilities are when we start engaging and investing with adolescent girls early on, and how much ripple effect that can have. Through your story, we can definitely see that investing in adolescent girls is a must, but as the research presented by Silvia says, the priorities are shifting and we cannot leave adolescent girls behind when it comes to achievement of SDGs. I'm so sorry we have so limited time, but there will be more opportunities to engage post the webinar. With that, I would now like to invite our next speaker, Dr. Rachel. Dr. Rachel is the policy and advocacy lead at the Accelerate Hub, a research consortium led by the universities of Oxford and Cape Town, which is building evidence to promote adolescent well-being in Africa. Dr. Rachel has previously worked for the UK government's Department for International Development as a senior social development advisor in Ghana, India, Mozambique, Pakistan, and Zimbabwe. She has also worked extensively on HIV prevention, care, and support, including as an advisor with UNICEF headquarters. Rachel has also worked on policy and programmatic responses to end early and child marriage. With that, Mike, over to you, Dr. Rachel. Welcome.
Thank you so much, and delighted to be on this really great panel today. And I think what Silvia's research has set out is a very disturbing picture. We know that COVID has impacted disproportionately on adolescent girls in terms of dropping out of school, in terms of increased early pregnancy and early marriage. And UN Women estimate that COVID has pushed more than 47 million additional women and girls into poverty. So at the time when we need more than ever greater investments in adolescent girls, to see that there is this sort of drop-off is concerning. But I think we also need to look at the funding for adolescent girls within the context of other overall aid cuts and aid flows. And it didn't actually surprise me to see the UK government slipping down the funders of adolescent girls when you consider that there has been a shift away from the 0.7% commitment to 0.5% of GDP. And that's had catastrophic impacts on a whole number of sectors, including on women and girls. And I think for those of you who are also looking at what's happening in the US, we need to look at gender and adolescent girls funding in the context of things like HIV funding, which with PEPFAR is now under threat of not being reauthorized. And that could have a devastating impact on funding on reproductive health, on funding on gender-based violence, and on sort of work on around social norms. So I think it's really important for the gender sector, not just to be looking at their own areas of funding, but also to be thinking about these other sectors that are under threat, and collectively to be highlighting what the implications of these cuts are for adolescent girls. So whilst we are in a quite, worrying environment about overall aid flows, I want to actually sort of shift to a more positive note, and that even though there is a sort of tightening of fiscal space and investment space, we are probably now in a much, much better position to know what works around investments on adolescent girls. And I just wanted to sort of shout out to some of the researchers on this call, people like Nicola Jones leading the GAGE work, Suzanne Petroni, who's been leading a lot of work with ICRW in the past and as an independent researcher, and many others, including the Pop Council, who've really improved evidence on the types of interventions that will shift us towards achieving the SDGs. And for myself and the team of researchers I work with at the Accelerate Hub, we've been building up evidence on interventions that can go to scale, that have maximum bang for buck across a number of sectors. For example, we know that in Ethiopia, girls that have had access to community health workers have much better chance of seeing reductions in early pregnancy, early marriage, and have increased educational outcomes. So really, governments putting money into programs like this can achieve multiple SDGs. We also see programs in South Africa where they're investing in a combination of sort of food security programs and looking increasingly at childcare, which can have impacts not just on getting adolescent girls who have had children back to school, but those investments can also have big intergenerational impacts on their children as well. And I think another area where there's much more positive evidence is around social norms and the importance of investing in girls' agency. And that's where a lot of the community-based interventions have been really successful. And whereas 15 years ago, I think we all had a hunch that this stuff was important, we're now seeing much stronger evidence that agency and norms change are a really important part of achieving the SDGs. So I think, we have this sort of growing evidence base, and I think it's important that these sorts of investments are not just important for girls themselves, and that is a really important end in itself, but we know that educated and empowered girls are more likely to secure better paid jobs, demonstrate healthier behaviours, and challenge social norms. And this will impact not just on them, but on their communities, and also will have these greater intergenerational impacts. So I think, although we are seeing these distressing shifts in aid and some greater aid skepticism, I think we do now have better evidence to really advocate for investments in the things that count, and really supporting investment cases at a country level. And I should mention that the Partnership for Maternal Newborn Health, UNICEF and others are doing a lot of work around these investment cases. So important that we get behind these efforts and ensure that the best evidence is promoting investments in what counts. But I'll stop there and look forward to the discussion later. Thank you.
Thank you so much, Dr. Rachel, for sharing your reflections on the evidence for supporting adolescent well-being. We have seen from all of the examples that you've presented of the community-based programming and from Louisa's personal experience as well, how much benefit can investing in adolescent girls can lead to. With that, I would like to invite our next speaker, Dr. Faith. Dr. Faith is the Chief Executive Officer at Girls Not Brides, the global partnership to end child marriage. And in that role, she's responsible for supporting and motivating the implementation of partnership strategy and for ensuring that the Secretariat is responsive to the broader movement to end early and child marriage. Before joining GNB, Faith served as the global director for the Girl Generation, an initiative working to galvanize the Africa-led movement to end female genital mutilation. She's a public health expert with more than 20 years of experience in leading, managing, and implementing complex public health programs in Africa, including working as the founding executive director of the African Palliative Care Association and supporting the global advocacy and services development in over 20 African countries. We're so happy to have you here with us, Dr. Faith. Over to you for your reflections.
Thank you so much. Again, it's a privilege to follow Rachel and Louise, and thank you, Silvia, for such an amazing report. And I think it's a timely report. It's really good to be seeing what's happening in the funding for adolescent girls landscape. And I think one of the things I first of all want to underscore is that I think there is more greater conversation globally and in our sector about inclusion and involvement of adolescent girls. So for me, that is welcome, and inclusion of youth. And while that is welcome, I think it's slightly disappointing to see that all that talk is not followed with the investment we need. But I cannot agree more with what Rachel has said about seeing financial cuts, investment cuts across the sector. We are seeing that even beyond with other sectors, that there is really ongoing cuts in terms of investments in the work we do. And I think that's where we need to think slightly more creative, slightly more different if we want to really see an increase or sustainable support for adolescent girls investment plan. I was interesting to actually see how child marriage has been affected, for example. And I want to say that while the picture is gloom and there is increased some decline, within Girls Not Brides, where I work, we have been working very hard with Girls First Fund. Girls First Fund is our sister organization who do grassroots funding and really funding girl-led organizations. And we have seen some of their work and some of their budget increase specifically around ending child marriage. So that is really welcome news. But having said that, we have seen some of the big government donors cutting back their resources. For example, the Dutch government, which has been a big government supporting ending child marriage, we have seen that there to be great cuts on terms of the investments they are putting, and really brought back some of the support, even some of the support they have given us as Girls Not Brides in the past. So we are seeing those changes across the board. And what has been some of the excuses, of course, is a public crisis, whether it's climate change, whether it's the cost of living, the war in Ukraine, you know, all these. Some of these things are really influencing how governments make decisions. We are also not seeing great investment from domestic financing from some of the countries we serve. And this is a big agenda on our work to make sure that we increase the allocation of work for gender and also for child marriage, specifically within the country level through the domestic financing. So I think for me, what is really critical about this report, and I think Rachel did allude to this, is making sure that we do really use this type of evidence, and we have strong evidence now, and thank you to Silvia and to others, Nicola. We have great evidence on how and where to fund adolescent girls, and even the impact, and even listening to Louise today, we are hearing some of the ways we can support adolescent girls. So what I see as a practical next step is for us to really do a case of funding. Like, what is the case of funding? What works in terms of funding adolescent girls, and use some of this evidence as our advocacy tool. I'm a big believer in advocacy as an advocacy tools where we can reach donors who perhaps right now are not investing in this agenda and who can be influenced. The other thing is to think about, where is the money right now? Where is the money going? Of course, one of the places where the money is going is sectors like climate change. There's a big talk on climate change. How do we get engaged with those sectors where perhaps we haven't been very vocal in? And I know there's a lot of evidence as well of the impact of climate change and gender, how it's affecting girls. So how do we get a foot in the door in terms of influencing some of those resources? When we think about other sectors, education, it will be very interesting if we are able to compare how resources for education, especially girl education, have moved around in the next few years. I was in a meeting recently about education cannot wait, and we were looking at how do we support increased investment in education in humanitarian settings. And I see, if you look at gender inequality as well, and you see vulnerabilities for girls, these settings are also the settings where girls are most at risk. So in collaborating and making sure that we are working with such partners, I call them sometimes unlikely allies. We have also seen greater investment in adolescent work, even through the Global Partnership of Education, through their education agenda. So it's really thinking about, where is the money going right now, so that we can really position the work we are looking for adolescent girls. So for me, while the evidence is great, is how we can use this evidence to push the agenda forward through advocacy, through awareness, increasing conversation, and most importantly, putting adolescent girls at the forefront of some of these conversations. I really like what Silvia said, that adolescent girls know what they need, they know how they can benefit. So we need to do much more, less talking now, more really bringing adolescent girls at the forefront. I know AGIP, and I'm a board member for AGIP, is doing a fantastic job in really positioning that, but are there spaces we are not reaching so that we can be there? Because I think this issue of budget cuts, we are going to see it increasingly more, and it's making sure that the issue we care about is not getting sidelined. There is a SDG summit coming up. How are we positioning some of those conversations, and how are we thinking about what is it the message we want to bring to that space in terms of adolescent girls? So partnerships, case for funding, and really making sure we continue to position this work and this agenda, because we have seen even within the child marriage arena, there is a critical rollback of resources on what we need to be able to do. I'll just, for those who don't know, Girls Not Brides is a global partnership to end child marriage. We are working with our members and movements across over 100 countries. And this kind of information, what we have heard being said now, is resonating across our members and the movement, especially in the climate we are in. So let's work together, let's increase our advocacy, and especially advocacy with unlikely donors and allies who perhaps have not been involved in this sector. Thank you very much.
Thank you so much, Dr. Faith, for highlighting the implications of decrease in funding overall for adolescent girls, but specifically also for child marriage programming, and also encouraging the funders and other power holding stakeholders to walk the talk, and within that, inviting all of the development sector practitioners to unite their strength and expertise and use the evidence that we have to make a bigger, stronger case. That definitely pulls all of the conversation we've had so far in this webinar together. Thank you so much for doing that. I know we are slightly behind time with what we committed with regards to the audience question, but what is very reassuring to see that the questions have been coming up in the chat, and our colleagues here, Nicola and Megan and Sylvia, have been responding to them, which is great. So questions are not necessarily going unanswered. We maybe have time to hear two more reflections or take two questions brief quickly just before we close this webinar for now. If anyone wants to ask a question that has not been raised in the chat and answered, please raise your hand and we should be able to call upon you. Within that, also, please let us know which speaker you're asking that question to, or if it's for Gage, then Sylvia would be happy to take that. All right. For now, I am not seeing any hands raised. And no further questions in the chat. We can take another minute if people are still preparing. All right. Thank you so much, Martha. All right. So it seems that people's questions have been answered. With that, that basically brings us to the close for today's webinar. Thank you everyone for joining us today. Special thanks to Silvia and Gage. Special thanks to our speakers who contributed from their perspectives. Thank you to Zadie and Yvette as well for providing the interpretation support, and for Flora for holding the technology. That's a big support. And thank you everyone else for your openness to join today's webinar and asking such important questions. With that, we hope that the research insights that we shared today would be helpful, as Faith mentioned, in leveraging the data we have for stronger partnerships and stronger advocacy cases on why investment into girls is needed, why it is urgent, where the investment needs to be made, and that we cannot leave adolescent girls behind when it comes to the whole conversation about sustainable development goal or any other agenda 2030 and other development goals for that matter. So thank you everyone. With that, please do definitely stay connected with us. Our social media channels and other mode of communication are available in the chat now, and so are for Gage as well. So yes, we will stay connected. Thank you so much everyone for joining.